Thank you for tuning in. I'm Kat Williams with Cat Pro Fitness, and I will be interviewing Dr. Rita Rodgers Stanley, and she will be a speaker at the Caregiving Event.
Hello, I'm Dr. Rita Rodgers Stanley.
Thank you for joining us. Tell us a little bit about yourself.
I am an internal medicine physician. I have been practicing for over 35 years. I am married to a wonderful man, Pastor Tony Stanley, and we pastor Harvest Church West Branch in Topeka, Kansas.
How is it being the daughter of a healthcare pioneer, Dr. Samuel Rodgers?
You know, it has been an absolute joy and honor to be Dr. Samuel Rodgers' daughter. He has always been a special man, and to me he's daddy, to me he's my father, and I honor him, and I honor him for what he stood for and what he did to help people get health care in this community for many, many years.
Why did you want to become a doctor?
That's pretty easy. I didn't know anything else to be. Dr. Rodgers modeled that for years before me. So he did it so well, and he did it so subtly that I didn't even realize that there was anything else you could be. So I always wanted to be a physician. His father, Dr. Rodgers' father, was a physician, so I also saw my grandfather model that. So for me, it was an easy decision to go into medicine.
Have you treated someone that has been diabetic? And if so, what was your experience?
I have certainly treated hundreds of people with diabetes in my 35-year career. I've done it from the perspective of traditional medical training, using insulin and medications and that sort of thing. In the last 15 years, I've had the absolute joy, to help people with diabetes using something called functional medicine. And that involves really reversal of diabetes with the use of diet. And I tell you, diabetes, contrary to much belief, is very much reversible. And people with diabetes can be empowered to change the trajectory of that disease in their lives.
Why did you decide to be a part of the Caregiving Event?
Well, Jim Nunley doesn't give you a whole lot of choice, right? But I'm so glad he asked me to be part of this event, because I do understand the importance of caregivers. I understand it from the perspective of a physician who has watched many patients I've watched over the years who would not have been able to stay in their homes were it not for caregivers who helped them. I had the honor of caregiving for my father at the end of his life, and having him in my home in his last days, so I understand it from a personal perspective. And then now I work in a place called PACE, Program of All-Inclusive Care for the Elderly, in Topeka, and our primary purpose is to keep people in their homes, in the community. So we rely heavily on caregivers in the home to help people at a point in their lives where they would otherwise have to be in a nursing home. So caregiving is so powerful and sacrificial, and without caregivers, it would just be a totally different world that we lived in. So I give great honor to caregivers.
What is one piece of advice that you would give to someone that is struggling with their health?
My word would be, it's never too late to begin incorporating habits and choices in your life that can totally change the outcome of whatever diagnosis you've been given. If you're struggling with your health, I would say to you, make one decision at a time. And the first decision I would have you make is around food. Food is medicine. And the reason many people struggle with their health is because they either don't know how to eat the right foods, or they just need some help getting to the point where they are making decisions around food. Food is curative, and I use it a lot now in my practice to help people who are struggling with their health.
I'm interested to know, what is one thing that you're proud of as a doctor?
I'm proud of the ability, proud of being able to be part of such an important piece of a person's life. I'm proud to have been part of a profession that, in my mind, is very sacred. We hold people's lives in our hands. So I'm proud to have been part of that. I'm proud to be walking out a legacy of healing. My grandfather was a physician. My father was a physician. And now I'm a third generation physician. So I'm very honored to be carrying out the legacy of being a doctor.
Did you ever feel discriminated against because you were a female African American doctor? If so, how did you overcome those situations?
Absolutely. I can think back years and years and years, from residency to first practicing. Unfortunately, it's part of this country. Early on, I'm sure I reacted more than I responded, and I was emotional about, experiencing that. But as you get older, as you get wiser, certainly as I became a Christian and started walking in that lifestyle, I understand that when people discriminate, it's not a problem with me, it's a problem with them. So I really, at this point in my life, extend grace to them, and if at all possible, I call it to their attention and try to get them to see it from a different perspective. But yeah, discrimination is everywhere, and it certainly is in healthcare and medicine, which for many years was predominantly a white male-dominated arena. So yeah, discrimination is part of life in the American society, and at this point in my life, having experienced what I've experienced, I won't say it's easy, but I have a different way of responding to it.
I'm wondering, since you're so successful, who are some of your role models?
Oh, so many. I would say certainly my bishop and First Lady, Bishop Steve Haupt, Dr. Donna Leah Haupt. They are especially my spiritual role models. They are the ones who taught me who I am in Christ. They're the ones who have taught me how to live by faith and live in faith. I would say my husband, Pastor Tony Stanley, is certainly a role model of someone who, just like my dad and grandfather, have sacrificed, have given their life to helping other people. He is a steadfast person in my life. I love him dearly, my husband. And my sister, I would say, is a role model as well. Someone who I model myself after in terms of just her faithfulness and stability in certain areas of her life.
What does the future hold for you?
Wow. There's so much. I'm in my 6th decade now, but I am nowhere near thinking about retirement. There's too much yet I have to do. There's too many young people who are considering healthcare that I want to impart wisdom in. So my goal and what I look forward to in the next 10 years is really helping to guide this next generation into the healthcare wellness arena, not just sick care, but healthcare wellness arena. And also, I love helping people in this functional medicine practice. So I see myself helping thousands of people stay well, and even if they already have a diagnosis, reverse those diagnoses with the use of good lifestyle, nutritional supplementation. That's my love and joy, so I look forward to that for many years. So there's still a lot left for Dr. Rita Rodgers Stanley.
Thank you, Dr. Stanley. I'm Catherine Williams with Cat Pro Fitness.